Hello, everyone. My name is Pharmacist Michael, and I am with
Julie.
Julie, and we had a pretty good interview with her. Probably 2 months ago, maybe.
It was back in May.
Hey,
Yeah,
wow, time flies.
it does.
And we actually talked about her stomach issues, about how she had GERD and was only able to eat just very minimal amounts of different things.
Yeah.
And when we talked to her, she was about ready to get a feeding tube placed and was hoping that would help her. And so I wanted to bring her back to see how her life has changed, whether things are better or worse, what she's learned from this whole thing. And so I'm just going to let Julie talk to you guys about how far she's come since May and maybe give you some tips on why you should be very careful if you have GERD and you think it's just heartburn and it doesn't get treated.
Yeah. So the last time we talked was actually the day before I got my tube, before I went in the hospital. Um, and that was an experience in and of itself because I was actually in there longer than I thought I was going to be because they were concerned about refeeding syndrome. Because
Oh,
before
yes.
I was doing some ranch dressing, my Diet Cokes, a little bit of tomato soup, and that was about all I was getting. So I was actually in for 4 days. I had to be up to a certain level of a certain intake of formula through the by pump before they would let me leave. And so since I've been home, it's been quite the adventure. So after I came home with the feeding tube, things were good. Everything was good. I had a nurse coming in, and everything was good. I think the more important parts are after what they call the honeymoon phase ends,
Oh,
where things get interesting. Is because in the beginning everything is good and you're getting nutrition and you're using your tube and doing everything you're supposed to do, and then I don't know, 2 or 3 months in, then it hits you everything you've lost by going through this. Even though this tube is life-saving and gives you the nutrition and fluids if you need it, it takes a lot away from you.
okay. So let's stop there for a second. What does it take away from you?
Depending at the time, anyways, I was on 24/7 feedings. So I was hooked up all the time. I was either hauling an IV pole around the house with me, or I have a medical backpack that I can put things in if I need to go out. And so a lot of it is a loss of freedom. So you lose a lot of your freedom with this. Um, and this may not even be a big example, but it was for me because in the house I'm in, I did everything I did to make it the house that I wanted it to be while I had the chance. And I put a hot tub in for my joints and to enjoy, and I had to give it up. I had to sell it.
Oh,
I can't take a bath. I can't immerse in water. I can't go swimming. I can't use the hot tub. So that was a hard hit because that was something I really enjoyed.
right.
Um, you do lose some friends. Um,
Because of the tube?
yeah, people don't. That's still an issue. People don't want to eat in front of you, and you'd be surprised. I was supposed to have family come in and visit me in June or July. They were supposed to come see me on their way back from Florida, and being right after I got my tube, I never heard from anybody. So I reached out and I said, "Hey, are you guys still coming? I'm looking forward to seeing you." Nothing.
So they just wrote you off.
Pretty much. Never heard a word. Never heard a word.
I'm
So
assuming you have some friends that this doesn't affect, though, right? I mean, people that you have known for a while, maybe close friends that,
I do have a couple of people, yes.
okay,
Um,
that's good. That's important.
it is. Yeah, I do have a couple of people who this doesn't bother. They eat in front of me. They don't care. Like I said before, I'll buy dinner for people. I don't care.
Yeah, right,
That it's not their problem that I have to do formula and all that kind of stuff. That's my problem, not theirs.
right.
But yeah, I do have a couple of people, literally a couple of people, along with my son and his fiance. But yeah, it's a very small group of people.
Okay, so how's your energy level?
The energy is back.
The energy's back. That's good.
Energy is back. It took a while. And of course, part of the whole thing with having a pump attached to you 24/7 is cleaning the house. How do you clean the house with, hauling an IV pole around all the time? That's
So is there a way you can feed yourself at night and just do 12 on, 12 off? Or is there a way that you could, I mean, isn't there some other options besides 24-hour feedings?
It took a while for me to get there, but yes.
Oh, okay,
Yeah,
good.
it takes a while to get there. Your nutrition has to be back on track, and up to par, exactly where you need to be before they will let you do something different.
Okay,
And once I got to that point, they let me go ahead and do bolus feedings, which is by syringe.
okay.
And it was unfortunate because as much as I enjoyed them, they didn't work out.
Oh,
I wasn't handling them well. I wasn't able to get all the formula in. I was having other issues with my stomach getting full too fast, regurgitation, food coming back up my esophagus instead of going, the
right.
where it should. So yeah, bolus feedings did not work out for me. So I've had to give those up, get my pump back again, and also do gravity feeds.
Okay.
So that has been a huge disappointment.
So how much time do you have now without that thing hooked up to you?
I do gravity feeds in the morning. I do 3 boxes of formula in the morning, and that's 2 or 3 hours. And then I do one bolus feeding at night.
So when you're doing the 2 or 3 hours, what do you do while it's happening?
I'm working.
Oh, you're working.
Hmm.
Okay.
Yep, I do it while I'm working because, doing gravity feeds, you're pretty well stationary anyways. You really can't go anywhere. I mean, I can haul the IV pole with me, but, you know,
Right.
I'm sitting there working, so why not?
Okay, that's good. So
Yeah,
you can that's good.
yeah.
Um, is there anything that you weren't anticipating about this that was good or bad?
The depression.
The depression, I was gonna get to that. So did you have you had depression before though, didn't you, when you couldn't eat at all?
I did. It was nothing like what I've been dealing with since then.
So this has made the depression worse.
It has. Because when you realize everything that you've lost and all the things that you can no longer do, and the things that you can do are now harder to do, and the people that don't come around anymore, um, the depression has been bad.
Okay, so I'm gonna sort of play devil's advocate here
Okay.
when we talk about these people. What I'm going to tell you, and you probably know this already, is if they're not willing to come see you now, they were never worth it anyway, right?
Yep.
Because you should not be defined by a medical condition, a tube feeding, or anything like that. People should love you because of who you are, not what you can or can't do, whether they can eat with you or not. It's just not the kind of person that you want to deal with. And as far as losing the ability to do certain things,
Mhm.
I think in time that will dissipate, because I think what's going to happen is you're going to realize that you can still do a lot more than, number one, other people can, but number two, you were on a downward spiral to starving yourself to death
Yeah,
before.
I was.
So at least now you have nutrition, and hopefully all that time where you couldn't eat didn't affect you too negatively, because if you don't get certain nutrients, really bad things can happen to your body.
Yeah, and protein was actually the biggest one that I was deficient in, was protein.
Right.
And that's a huge one to be deficient in.
And you may have already done this, but I strongly recommend finding a support group of people that have the same type of issues that you have. There has to be them. Those type of people have got to be, and I don't care if it's on Facebook, if it's on Twitter, if you find a group anywhere,
Yeah.
there's got to be tube feeding group. And I don't know if you ever talked to Marissa. She comes into the live sometimes. She would be a good resource because she's been tube feeding for years.
Really?
Yes.
Yeah, and I have people on TikTok that,
Good.
I watch on a regular basis. I watch Kat, and there's several other people that I also watch.
Right. And sometimes when you're depressed, it's funny because I just before we came on here, I just got done recording a new video I'm doing a depression series right now on YouTube. And the one I did tonight was on non-medical ways to fight depression. And one of the big ones is getting in a group of your peers and talking through some of this stuff. Because, a lot of people that are depressed, they feel bad. There's the stigma of mental health and all this other stuff, but really it's all just a bunch of baloney if you think about it. People that don't want to deal with people that have mental illnesses are not worth your time anyway.
No. Nope, not at all. And, I've been working hard with therapy and everything to get past all of it.
Right. And that's what you should be doing.
Yeah, and I'm finally coming out the other side of it.
Good.
Yeah.
That's good.
It's getting better.
Good. Because a lot of people don't reach out for help.
No.
They just stay in their little house or wherever. They isolate, and it just gets worse and worse if you do that.
Yeah. And I've been in therapy for a long time.
Oh, okay. Okay.
My therapist has been helping me with getting past all the hard spots with the tube. And like you said, the things that I can't do, the things that I can do, the feelings of being useless, because there's a lot of the things I enjoyed. I enjoyed cooking. I enjoyed cooking for other people. And, now there's literally no food in my house.
Right.
Because I don't need it.
Yes.
So,
well, you need it. You just get it in a different way.
Exactly. Yeah. I don't go in there and use the oven and the stove and all that. I don't do that. And
so have you found other things that you enjoy that you can do?
You know what? I really haven't.
So this is going to be something that you're going to want to do, is find something, a hobby, something that you enjoy doing that you can still do.
Yeah.
Could be making videos on TikTok, on tube feeding. I mean, I don't know what it is, but something.
And I had actually started to do that before the tube, and I did some after that I had the tube as well, but the depression got me, and I still watched, but I just kind of dropped making of the videos. And I need to start again, because
I think you should, because you know what? If you can help people, if you can find a way to help people go through what you just went through, you're going to feel a whole lot better about yourself. I promise.
Yeah. And that's what I'm doing, is helping people.
Yep.
And that was my whole intent on when I started doing those videos, was to help people.
Yep. And
That's
you will help people, because there's going to be people out there that are scared to get the tube, don't want the tube, don't want to have anything to do with the tube, right? Because I remember when I talked to you the first time, you were excited about it. You were ready for it, right? Because
Yep.
you've been suffering for so long.
Mhm.
But there's a lot of people out there that really don't want anything to do with this.
And it's the tube itself is not bad. The tube is easy.
Right.
Everything you have to do with the tube is easy, from cleaning to feeding to medicine. It's all easy,
Yeah.
but it is life changing.
Right.
And if you have to have it, you have to have it.
That's what I was going to say. The alternative is a whole lot worse than the tube.
Absolutely. It is absolutely worth it to have it.
And you are a long ways from being worthless. I mean, you know that. You're not.
Absolutely, I do.
Uh-oh. I lost you there for a second.
Oh,
You're a long ways from being worthless. I mean, that's you're productive, you're working, you feel better now.
Yeah.
You said you're coming through the other side.
Yep.
I don't think there's a single person that is over 20 years old that hasn't been through some depressive episodes. They might not admit it, but we've all been through bad things in our life. I look at them as less than ideal, but you know what I mean? Things that you wish you didn't have to go through.
Yeah, and I think, I've heard this before too, and I think it's super, super accurate. It's mourning who you used to be.
Right.
And how you used to be, and the things you used to be able to do. And I think that's where I've been.
But as we get older, there's a lot of stuff I can't do anymore that I used to be able to do.
Yeah, me too.
I mean, it happens to every one of us. And I think that that's just part of getting older. And you can choose to look at that in a couple of different ways. You can either think about the bad reason, the bad things, or you can think about the good things. I mean, the good things are, more, you've got a lot more knowledge and wisdom, and you're better able to help people. And I think that, at least for me, what brings me the most joy in my life is helping other people go through the things that I went through. Mine was different than yours. Mine was really bad anxiety, but I was depressed too for a long time. And a lot of it was just because I thought I was stuck where I was and I was never going to get out. And I was using alcohol and other things to make me feel better, I thought, right?
Yep.
But really all I was doing is making it worse.
Yeah. No, it's not easy. Life isn't easy.
No, it's not.
If you have the right attitude, you can and will get through it. And that's
right.
What I'm doing now.
Yep.
It's important.
It is important. And if you can help younger people, or even people, sometimes they're not even younger, they're just people that haven't, like I said, the depression thing, if you're isolating and you're by yourself, and some people now, you don't even have to leave your house, right? Yep. You can have food delivered. You can do almost you can work from home.
Yep.
So you don't ever have to leave your house. And there's good parts to that, but there's also bad parts to that, because if you never see other people, touch other people, you know what I mean? It's horrible for us because we are a social being. So technology sometimes can be detrimental.
Yeah. And that's where I'm at. I mean, I work from home. So unless people, I live an hour away, at least an hour away from most people that I know. And so me working from home, I don't see a whole lot of people.
Right.
So I have to make that extra effort.
Right.
And it's worth it. And also, I'll tell you this too. I had to have a gastric emptying test because they thought I had or we all thought I had gastroparesis.
Yep.
But in doing that, talking about seeing other people with what I have too. There was a lady and her husband there, and towards the end we started talking, and she had a tube as well. She had a G tube and a J tube, and we both hit it off because, oh, you have that too? Yeah.
See?
And we understood. She said, my husband doesn't understand this and doesn't believe, but now he's heard you and now he believes me.
Right.
Yeah, it was. I wish I'd exchanged numbers with her because that would have been a wonderful connection to keep.
Absolutely.
But hindsight's 2020. Didn't think about it until after I'd left the hospital and they were long gone.
Have you looked into Reddit to see if there's got to be a subreddit for tube feeding people? There has to be.
I would think so.
There's a subreddit for everything.
Yeah. I think
so that would be some place you might want to check just to see if you can find a group. I bet if you went online, just on Google, you could find some sort of, there has to be a support group for tube feeders. There has to be.
I would think so. And I think my other main focus that I want is to be helping people on TikTok.
Yep. And I think that's a great idea. There's billions of people on there.
And I want to get back into focusing on that.
Yep.
And I want to start putting out the videos and making people aware of what can happen if you have GERD and you don't treat it.
And I think that's probably your number one thing that you can teach people, because there's so many people out there that think if they have heartburn, oh, it's just going to go away on its own. I can take Tums, I'll just live through the pain. No. And before you know it, you can't eat.
Yeah.
And it doesn't happen to everybody, but it can happen. And you're perfect. You're evidence of that.
Yeah. Yeah. It's really important. You can take all the Nexium and all the Tums, and if you're still experiencing that heartburn,
yep,
don't it, because it'll cause scar tissue in your esophagus, and you can't get rid of scar tissue.
And you're also a good example of what can happen if you trust one doctor and don't go get second, third, fourth, fifth, sixth opinions.
Yeah.
Because that's what I always tell people. I have a lot of people ask me about stuff. Well, the doctor said this and the doctor said that. And I said, hey, if you're not happy with what the doctor says, go find another one and get a second opinion, because doctors are just like everybody else. Sometimes they don't know what's wrong with you. They take their best guess and that's it. And a lot of times patients get labeled as being addicted to something, or they're hypochondriacs, or, there's all these labels that get put on patients. And sometimes it's not true at all. The patient really does have something different than what the doctor thinks.
Yeah. And what happened with Dr. Parker? Well, I probably shouldn't say his name, but yeah. Not that he'd ever see this, but what happened with him and him just dropping me and then having to go to Vanderbilt to get, what I needed done, that also has been a struggle. The advocating for myself has not stopped. And it has been maddening because
Vanderbilt's the one that found out what was wrong with you, right?
They did, yes. But I have still had a very touch and go relationship with my doctor. Very, very touch and go, to the point where I was ready to leave.
Yeah.
My primary care wanted me to check out Mayo Clinic.
Yeah.
Them.
Because, I can't tell you how many times. I mean, remember Becky's story. I mean, look at what she went through. They just kept giving her opiates, giving her opiates, giving her opiates, giving her opiates. All it did is make her feel like crap. She never got better until her husband happened to hear about ketamine on a radio show, right? And now she's almost I just saw her on here not very long ago. She's completely changed.
Wow.
So, and I don't know if you saw, I talked to a very good friend of hers who is doing the nasal ketamine, and her story is very similar. So don't ever just believe that one doctor, they're not gods, and
No.
they're wrong sometimes.
And just as important as getting the GERD treated, it is just as important to never stop advocating for yourself.
Exactly.
Never, never, never. Because even once you get what you need from me, the tube, it's not over yet.
Nope.
It is
That's right.
over, and you have to keep pushing. And
Yep.
that's what I've had to do. I mean, to get the gastric emptying test, I had to push and push and push. They only gave in to shut me up.
Well,
That's why that, and when you keep pushing, even if it's, they want to shut you up, at least you're getting what you need.
yes, that's right.
The squeaky wheel gets,
Especially when it comes to healthcare. And, I'm fortunate because I'm a pharmacist. So when I go in there, they listen, but they shouldn't really treat anybody any differently. But
no.
a lot of times I wonder, if I was a construction worker or a lawyer or something, and I had nothing to do with medicine, would I get the same treatment? The answer is probably not. It does depend on the doctor, though.
Yeah.
And, the fact of the matter is, doctors are really good at things they see a lot of. So if you have a heart attack, they're probably going to recognize it and know how to treat you.
Yeah.
But if you've got something like you have, they may have never seen somebody with the condition that's came from that's that bad.
Yeah.
And if they don't know what to do, the only thing they can really do is ignore you or refer you somewhere else.
Yep. And hopefully, unlike the last doctor, they refer you and don't drop you.
Right.
Yeah. Because
Well, and if they're going to drop you, they really, in my mind, they should refer you or at least give you someplace.
yeah. And the other thing is, along with advocating for yourself, do your homework. I mean, doctors, they know their stuff, but you still need to do your homework.
Yep.
Know what sites to go to, know what's legit, know what, where you can go, what's not good to rely on, and do your homework. So
Yep.
you do go and you're having to fight for yourself, you know what you're talking about.
Yep. That's right.
And that helps a lot too.
Yep. I think that at least you know the kind of questions to ask.
Yeah.
You know?
What's going on with me before I ever go talk to them. So that I'm armed with information.
Right.
So that they can't pull the wool over my eyes. Because I don't know how much detail to go into, but I've had another issue that I've been trying to get worked out. But it's another one that they won't listen to me on. And I had to go in because I had an infection in my stoma. And so I had to have antibiotics, and I wound up having to go in and see them. And we did have a discussion, me, my doctor, and the doctor that did my surgery, who's actually above her. And they said, we're going to wait until December when you come back because we want to make sure you get the right test. Why wait until December?
Yeah. Why would you do that?
I'm right here, and I've told you what's going on. You've, acknowledged it. Let's just do it.
Right.
But no, they will not. She had me do a colonoscopy to make sure everything was good there. Everything turned out fine. So now we know something else is going on.
Right.
Most likely some sort of dysmotility in my GI tract.
Yep.
They're down the road, caused by the starvation and malnutrition. With the protein, having to do with every muscle in your body, things don't always recover from that.
That's right.
So yeah, it's tiring to keep pushing, but you have to.
You have to, because no one's going to do it for you.
No.
They're just not.
No. And I was ready to go. And something else I've learned is that the doctors don't like you seeing other doctors in the practice. They don't want to, like with Vanderbilt, there's several doctors in the practice. You have to be released from your doctor to see another doctor in the practice. Or if you go to another doctor just in Vanderbilt, you have to be released to go to that other doctor. Because I did try to go to another Vanderbilt doctor and he wouldn't take me.
That just seems you should be able to go to whoever you want to.
Yeah, and they make it hard. They will not let you. Most of the time they will not release you. So unless I go somewhere else completely different, I'm pretty well stuck. So then you weigh the options. Do you stay where you're at because they know they put the tube in? Or do you go somewhere else where you're not too sure what the care is going to look like over here? And then realize that they're not so good and you really need to be where you were. And somewhere in between, you might lose care.
So how do you get them to release you?
You just ask. That's all you can do is ask.
And have you tried that?
I have not. Because the other doctor wouldn't take me. He said it was too complex. And I really think by that he meant that you're already seeing the other doctors and I'm not going to touch this.
Yeah, I know a lot of surgeons don't, if there's something happened that went bad, they don't want to have anything to do with it. And I don't know if it's because they don't want to get sued. I just don't know what the reasoning behind that is. You would think that they would be willing to help people if they thought they could, but
I don't think they want to be the new doctor doesn't want to be the one who goes in and finds another doctor's mistake.
but it's not about the other doctor, it's about the patient.
Exactly. It is about the patient, but they make it about each other, not about the patient.
Yeah, see, I have a problem with that line of thinking.
Yeah.
That's not what they're supposed to be doing.
And that impedes our ability to get care.
Yes.
It's tied to change.
Well, I think another title for this is when the healthcare system fails again, because it's what it sure sounds like happened to you.
Yeah.
It's just, our system definitely isn't perfect.
No. And one of the doctors that I do see, actually, it was the surgeon. I think I remember telling you about my educational visit with this doctor and how he was such a bully.
Yeah.
Nothing's changed. He's still a bully. When I went in there to see them, my post-op appointment about 2.5 months out, I was waiting for them to say something about it. Nobody said anything about a post-op. I had the December 1st appointment already, but I thought, why are we waiting from May until December before you see me again after surgery?
That does not sound reasonable at all.
No. And I had to go to patient relations and, talk to them about what was happening. And it was amazing. I got an appointment right away to see him. And while I'm there, the bullying started again. Well, you do know you need to enjoy this tube while you have it. It's going to be the best tube that you'll ever have because the next one will have a lot more drainage involved. It's going to be a lot easier to pull out. And he says, and when we take this one out, all we're going to do is retract the bumpers and pull hard.
Oh, God.
I'm like, way to go, Doc. Thank you so much. Now I'm terrified. And the other doctor, when I was in there, I don't know, it was a month ago or so.
That guy doesn't have a good bedside manner, does he?
No. And she actually said the same thing. She said, we'll retract the bumpers and then we pull. I'm like, this does not sound promising. Can you not give me a pill? Can you not put me
something?
Punch me in the nose? I don't care. But the other thing is that after this one's out and I get my new one, I have to change it myself. They will no longer be responsible for changing my tube.
Why is that?
That I don't know.
I think you need to talk to Marissa. I really do. I think it would help you tremendously.
Yeah.
And I'm sure she'll talk to you because she's very much, You know, she's probably the best healthcare advocate I've ever met. And I think it's because a lot of what has happened to you has happened to her. She's just been through it longer.
Yeah. Yeah. I'm willing to talk to anybody because it's, it's scary, especially when you have a bully for a doctor.
Yeah, I mean, it's just not,
It's not cool.
no.
It's not cool at all. And I'm December 1st appointment. I may have to have my tube changed. It may be time. And I am absolutely terrified to go in there and get this done.
I would ask her another question you might ask Marissa is, is there something that you can do to make that easier? Have you had medication for that? Because why couldn't they just give you a little midazolam or something? You wouldn't remember anything and it would pretty much knock you out. It's a super quick acting benzodiazepine.
Mm-hmm.
They can give it to you nasally. They can give it to you injectably. I mean, there's almost tons of ways you could get it. You don't have to, take it by mouth.
Right. And I think one of the reasons they want me awake for it is because it's also going to be a training thing where they train me to put the tube in.
Maybe.
And how to remove it. But I don't understand how I'm even supposed to see to get it done. But, that's something I've got to, write them about or talk to them about and draw the line.
Right.
If I have to come in every 3 to 6 months to have you guys change it, then that's what we're doing. Because I'm not comfortable with it. And if that's the case, I should not be forced to do it.
I agree with you.
Yeah. But that's just another roadblock with those doctors is that they're bullies. They're not very good as far as bedside manner and dealing with people.
They don't make you feel comforted.
No. And my whole point with them and going through all of this with them is that this is supposed to be, a group. This is supposed to be an experience where we all sit down, we all talk, we put everything out there on the table, and I play just as big of a part in my own care.
Right.
What happens to me and what doesn't happen to me. And I told him, that's all I want. You guys are the doctors, you guys will have the final say, but I deserve to be in there too. Not just being thrown stuff and you're going to do this and you're going to do that and you're not going to do this or that. I need to be a part of it.
I agree.
And this last appointment I had was better than the others, but we'll see where it goes from there.
You've got a good story.
Yeah. It never ends. And as long as
I hope it does end at some point. I mean, I hope that you get to the point where you can feel comfortable changing the tubes and doing whatever it is that you need to do.
Yeah. I mean, I'll get through it. I mean, there was a time when I first got this tube, I call it the heebie-jeebies, just kind of, ugh.
Yeah.
When I was told I'd have to go in, if there was extra drainage there, go in with one of the medical Q-tips and just kind of, nudge away any drainage that would come out. And I didn't like to change my dressing. I didn't want the tube dangling. That was something I didn't want. And I'd sit in a position where my leg was high enough to be able to rest the tube on it because I hated it.
Yeah.
But now it's all easy.
Right.
I went through a whole phase of learning how to do everything and not be afraid of it.
Wow.
But it's doable. And like we talked about, I want to be helping people. I
think that's your calling here,
Yeah, I do it every day for work. That's why I do what I do. But I want to take that and transfer it and use my experience to help other people.
And I think that's a perfect idea.
Yeah.
That's what I've done. And that's what brings me the most joy. I mean, by far.
And, in helping people, you help yourself.
Yep.
Because you learn from other people as well.
And it makes you feel good.
Yeah. Absolutely.
I mean, if you can save one person from being super scared or ending up in a place that they don't want to be, it's worth it.
Absolutely. And I plan on pursuing it. I've been thinking about putting videos out, which is further along than I have been. So I'm going to get back into it. I
You
really
should.
do make a go of it.
You should. And you know, it just becomes a habit after a while. It's
Yeah.
always hard to restart.
Yeah.
But if you just make sure that you schedule time for yourself, things that you know will make you happy, even if you're scared at first, or even if you don't feel like it, you know, depression will rob you of a lot of joy.
Yes.
It will. I
Oh,
mean, and your mind, oh, I don't know if I just don't feel like it. But man, just it's kind of like exercise, you know? If you haven't exercised for a while, you don't want to do it. You think, God, I don't. But then once you do it, you feel so much better.
yeah. And I need to get back to that. I have not because I've still had issues keeping my weight up. So I have not done anything that would purposely cause me to lose weight
Right.
yet.
Right. And I think that that's important.
Yeah. Because even though I'm getting my formula, I've still been losing weight and we don't know why. And of course, the doctors are not real interested in finding out why.
Another thing that Marissa could probably help you with. I'm sure she's been through it.
That would be awesome. Absolutely awesome.
So I'm gonna probably start going live on TikTok at least a couple times a week. And hopefully one of these times, both of you will be in there at the same time. She comes in a lot. Um, or, you know, another thing I could do is just, I'll find her name and I'll send it to you
Okay.
so you can reach out to her because I'm sure she'd be happy to talk to you.
Yeah, and if you want to, you can always give her my information too.
Yeah.
Reach out if she's not comfortable with me having hers.
Yeah. I could do that. Okay. That
I,
sounds good.
yeah, that would help a lot.
You know, you guys could do dual lives and probably help twice as many people, right? Because you'd have two people on there at the same time talking about the same thing.
That would be phenomenal. I'm still working towards being able to do lives, and I know my absence has greatly hurt that, but I'll get there.
You will.
I just have to keep putting out content,
Yep.
and I will,
Yep.
as with everything else, I will get there.
You will get there.
Yep.
Absolutely.
A lot of determination, a lot of advocating, but yeah, I'll get there.
You will. Well, thank you so much for coming back on here.
Well, thank you for having me. I've been
I
looking forward to it. I thought I was ready before, like 3 months out. And now I've realized that, yeah, I was nowhere near ready. None of the experience was there or anything else.
I think you will help people just by watching this. People will see this and they will, you know, I think a lot of times people need to see the struggles other people are going through, especially when they're right in the middle of it.
Yeah,
And it just gives them hope for coming out the other side.
absolutely. Yeah. But I'm glad we got to do the second one. I've been looking forward to it.
Yes, me too. Okay, I will get some information to you. Um, and maybe I will send Marissa a quick message
Yeah.
and have her reach out to you.
Yeah, absolutely. I may not be able to do lives, but if she can, her and I can, if she wants to, hook up and do one together. I would absolutely adore it.
That would be wonderful.
Yeah.
Okay. Thank you, Julie.
All right. Thank you, Michael. I appreciate it.
All right. I'll be seeing you soon, I'm sure.
All right.
All right.
Absolutely.
Thank you, everybody, for coming on. That was Julie, a friend of mine from TikTok. And my name is Pharmacist Michael. Like I always say, be happy and be healthy. If you have any questions or comments, please leave them in the comments section.